Okay, this particular procedure is called the occipital lift. The reason why we would do it is if patients have some headaches, if you have some sinus pressure, and then anything related to more of the cervical spine as well. So let me show you how that's done. Jane, turn your head off towards the side, towards me, and to the left. Yeah, let me come around the side here just a little bit. Hook underneath through here. Let it relax a little bit. And I'm going to turn you off to the right, come on the side. And then we'll do the same procedure right through here. Relax a little bit to your shoulder. There you go.